So tonight we're going to talk about how to get back to deadlifting after you have a low back injury. Because low back pain is really, really common. Over 90% of Americans have it at least one time in their life. And for a lot of people who go to the gym, deadlifting is one of the most common movements that you do. And there's a lot of fear and anxiety sometimes around deadlifting and is it good for your back? Is it bad for your back? How does a back injury influence your ability to deadlift? And so on and so forth. So tonight, I'm going to take you through a progression that I take most athletes through when they come see me after they have a back injury, and we're working towards getting them back to deadlifting. So we are going to start first with the PVC. We did this, we talked about this last week, where you have those 3 points of contact, your head, your mid-back, and your sacrum, and you're just deadlifting, just like this. A little bit further down, my hamstrings, again, are tight and sore, so I'm not getting the normal amount of motion that I usually get. But that motion in and of itself, just doing the motion and seeing if your back can tolerate becoming parallel to the ground and going against gravity, just seeing if you can tolerate that is where you want to start. Because if your back can't tolerate that, you shouldn't be putting weight on a bar and loading it up yet, because that's only going to flare things up and make it worse. When you can, or if you can tolerate just doing a hip hinge, that single motion at the hip with a PVC, from there, a nice progression is deadlifting from an elevated surface. You elevate the surface because it decreases that excursion that your back has to go. So from here, I go down to here. I don't have to go quite as close to parallel here, whereas if now I back up, I go a little bit further down with my torso. So it's just eliminating that end range position of the torso coming parallel to the floor. Usually, the more the torso comes like this, the more shear forces get placed on the back. Usually in back pain, shear forces are not well tolerated. So if you minimize the shear forces on the back by decreasing the range of motion that you're going through, usually that's better tolerated. I usually start individuals at a higher surface, so maybe think like a small box, and then progress down. This is a 45-pound plate. From here, once this is really good, you can go to the floor. So you can get this weight plate out of the way and go straight to the floor using a kettlebell instead of a barbell for deadlifting still. You can go heavier on the kettlebell. They have pretty heavy kettlebells. You can go all the way up to whatever you want with it. But the reason you want to use a kettlebell instead of a barbell for that next step is because the kettlebell allows you to bring the weight closer to your body. When you bring the weight closer to your body, you're minimizing that lever arm. For those of you who understand physics, the shorter lever arm puts less load on something. If you don't understand physics, hold an object really close to you and then hold the object really far away. You're going to find it much easier to hold it really close to you. Same principle applies here. So deadlifting here, I can put the weight here and bring it up, whereas if I had a barbell, bringing this directly out to the side, it would hit my knees or it would come back. It would be basically too far back, wouldn't clear my knees. The barbell, basically, I'm starting this kettlebell further back than where the barbell would start. So that allows me to decrease the lever arm, place less loads on the back. So there you have it, a simple progression for returning to deadlifting after you have back pain. Start with the PVC, make sure you can just do the hip hinge. From there, start with an elevated surface with a kettlebell and work your way to the floor. Once you're at the floor with a kettlebell, switch to a barbell. Once you hit the barbell, then increase the weight, then increase the volume. If you have questions or you're struggling to get back to deadlifting after a back injury, shoot me a message. I'd love to help, and have a wonderful night.